Good evening, everybody. I am Dr. T.S. Ramaswamy, Chief Physician, Sai Hospital, Palakkad, Kerala. Today's talk is about the diabetes and the heart care. So, how to take care of heart in diabetes? At present, heart disease remains leading cause of hospitalization and death in patients with diabetes. Although most people have heard of heart disease, few understand exactly what it involves and in turn may not be taking proper steps to reduce the risk of heart disease. And as you all know, diabetes as such, they don't die of diabetes. Diabetes die of some complications like heart disease or renal disease or some other vascular problems. So heart disease occurs when the blood circulation into the heart is slowed or stopped because of the blocked artery. What can be the reason behind the block in the artery? One of the major risk factors is high sugar level, also known as diabetes. So let us know what does the diabetes exactly mean. Usually, when you eat food, the food is digested, and whatever food we eat, that is converted into glucose. Glucose enters the bloodstream. From the bloodstream, it has to enter to the cells to produce the energy. So that for that, insulin is needed. So the insulin, which is a hormone, facilitates it acts as a gatekeeper. Only when the insulin is there, sugar will be able to enter the cells. Only when the glucose enters the cells, energy will be produced. Otherwise, the cells will be starved. Did you know the diabetes can increase your chances of dying from heart disease? It is very much true. With diabetes, you are likely to have heart attack compared. You are likely to get heart attack compared to normal people. So when it comes to diabetes, prevention is very, very important as it can affect your whole body from your eyes to your feet, especially your heart. So when it comes to diabetes, prevention is very important. In fact, people with diabetes are twice as likely to have a heart attack or a stroke and compared to people without diabetes. And it is reported that among diabetic people over the age of 65 years, approximately about 68 to 78% die from heart disease. The chances of developing heart disease among people with diabetes is not dependent on how well you manage your glucose level. So when we think about diabetes, we should really be thinking about the heart as well. So how to take care of heart in diabetes? Move on, let us see how high blood sugar leads to heart disease. High glucose can damage the blood vessel, worsen the lipid levels, and make blood pressure more difficult to manage. The persistent high glucose level due to diabetes make the blood vessel prone to atheroma. That is, whenever there is high glucose, that gets deposited, that endothelium becomes rough, and there the fat deposit, and it becomes the blood vessel gets narrowed due to the deposit of atheroma. This condition is narrow over the blood vessel due to the collection of bad cholesterol. When the blood vessel is narrow, blood flow has trouble in reaching different organs in your body, including the heart. A sudden stoppage of blood flow to the heart may cause heart attacks. There are a number of things you can do to lower your risk of heart disease. Understanding the connection between diabetes and the heart disease is the first step towards the prevention. Diabetes is commonly referred to as lifestyle disease, and managing diabetes requires changes in lifestyle, and it should be a lifelong commitment. And because the diabetes is a very chronic disease, most of the time it is a lifelong companion. So we have to change our lifestyle. And what else we can do to change the lifestyle? We will look into that now. So to control the diabetes, you should know ABCs. That is, A stands for A1C. That is, A1C is the hemoglobin A1C, HbA1c, otherwise known as HbA1c, is a test measures the average blood glucose for the past 3 months. It is different from blood sugar which you do daily. That is also you have to monitor daily. You need to know your blood sugar periodically and how well you are controlled. Once in 3 months or 2 months, you have to get a A1C or HbA1c, and that should be, in most of the people, it should be less than 7. And sometimes it differs for some people if they have got other comorbidities like renal failure or other old age problems. And blood pressure is the flow. And what is B? B is the control of blood pressure. The first one is A, but A stands for control of HbA1c. B stands for control of blood pressure. And blood pressure is the force of your blood against the wall of your blood vessel. If your blood pressure gets too high, it makes your heart works too hard. The blood pressure goals for most people with diabetes is below 140/80. It may be different for some people, especially if they have got other comorbidities, or if they are very old, if they are brittle, labile, that their goals will be slightly different. So we should ask the doctor what their goals of BP should be, what their HbA1c should be. And C for cholesterol. Cholesterol, there are mainly, basically, we will get to know about only 2 types of cholesterol. One is LDL. LDL is a bad cholesterol which builds up and build up in the arteries, and which produces atheroma and plaques, and it causes clogs. Whereas HDL is a good cholesterol which helps in clearing the bad cholesterol from the blood vessels. It acts like a sweeper. It removes the bad cholesterol. So you have to ask what should be your goal of cholesterol. Usually, if you are over 40 years of age, you may have to take statin for your heart health, and your cholesterol level should be less than LDL, that is low density cholesterol, that is bad cholesterol should be less than 100. Or if they got other comorbidities like heart disease or renal disease, then it should be further less. Further, it should be reduced to 70 or less than that. Lesser the LDL, better it is. So other things to manage diabetes is, there's no one size fits all approach of eating healthy, but it is important to have regular meal patterns and make healthy food choices. Your fat and carbohydrates are crucial to manage both diabetes and heart disease. Make simple switches from saturated fat to unsaturated fats. Having too much saturated fat can increase your blood cholesterol levels. So it is important to reduce the amount you eat and instead get fat from the unsaturated source. Switch butter and ghee for unsaturated vegetable oils and spreads such as sunflower, olive or rapeseed or corn oils. Trim visible fat from meat and remove the skin from chicken. choose lower fat milk and dairy products, and swap biscuits and avoid biscuits, cake, chocolate for a healthier snack such as fruits. Remember, fatty foods are high in calories and excess energy results in weight gain. To help you manage your weight, it is important to keep an eye on the total amount of fat you are consuming. Different fats have different effects on the body. Diets high in saturated fats are linked to higher levels of bad cholesterol. Eating unsaturated fats instead of saturated fats helps in maintaining healthy cholesterol levels in the blood. So another thing, eat right. Avoid refined wheat breads and cereals, potato chips, fries, red meat, processed meats, saturated fats, and sugar sweetened beverages. Eat food with more fibers such as whole grain, cereal, dairy foods, beans and legumes, lean meats and fish, nuts and healthy oils such as olive oil, choose food such as green leafy vegetables, bread and cereal, and low fat or skim milk and cheese. Cut down on salt. Too much salt is linked with high blood pressure, a major risk factor for heart disease. Most of the salt we eat is already in the processed food. Check the labels and go for those with the lowest salt content. So learn how to read the food labels and make healthy choices. So if you, in short, you should know diabetes mainly affects the diabetes people are more prone for heart disease. They have got twice the risk of developing a heart disease or stroke. So they should take care of their heart by controlling their blood sugar, blood pressure, and lipids. So thank you very much.